This is the aspirational story of community systems working together to support families. The fictional Reyes family experiences some challenges, but with help obtains a medical home, a financial home, and a safe, affordable place to call home. Meet Sonya, her husband Daniel, and their son Matthew. Daniel works in construction and Sonya is a stay-at-home mom. Daniel earns about $37,000 a year, though monthly income can be unsteady in construction. The Reyes family lives in a small home in East Austin with Sonya's mother. They pay $750 a month for rent. Though it's affordable, the house is old and needs maintenance.
Matthew was in 3rd grade at Ortega Elementary in AISD. We love Ortega. They speak to my mom in Spanish and we always feel welcome. One day, after running on the playground, Matthew couldn't breathe well.
Are you okay? Can we go to the nurse?
Miss Clara, the health assistant, helped him out.
My name is Miss Clara, okay? And I'm the school health assistant. And I'm going to give you some water. I want you to sip it slowly, okay? Meanwhile, I'm going to take your vital signs.
She contacted the nurse and then EMS.
He was found on the playground, shortness of breath.
She called me and I walked over as soon as I could.
Matthew, are you okay?
Mom, Matthew is fine. EMS, they have checked him out, so everything was fine.
We didn't know Matthew had asthma.
He needs to be taken in.
The EMS folks said Matthew didn't need to go to the hospital, but he did need to see a doctor. Because we didn't have a doctor, Miss Clara got us in with the Children's Health Express van. I told Miss Clara we didn't have insurance, but she said that would be okay.
They will still see Matthew.
At Children's Health Express, Matthew got his medicine and an asthma action plan for school. I was 5 months pregnant and hadn't seen a doctor yet because we had no insurance. The social worker helped me connect to the nearby community care clinic. At community care, I got prenatal care and was signed up for the WIC nutrition program. I was anxious about paying the bill. My husband's truck had broken down. We didn't have cash, so I took out a payday loan and we needed to make those payments. When the nurse heard that, she told me about the Family Resource Center down the street at Martin Middle School. The Family Resource Center helped us get groceries from a food pantry. They helped us get utility assistance so we could pay off the payday loan. We began to eat better, and I signed up for a class at the Family Resource Center. I learned how to get a bank account through the class. Because of Matthew's asthma, we were referred to Austin's Green and Healthy Housing Program. They did a housing and health assessment. They found some mold and cockroaches that could affect Matthew, and noticed that my mom could use a ramp so she didn't trip on the stairs. The Austin Housing Repair Coalition coordinated with the city and got the repairs done for the house. A few months later, I had my daughter, Gabriela. Then we learned from the housing authority that we had gotten a housing voucher. We had been on the wait list for 4 years. With the voucher, we found an affordable place for our growing family. Matthew didn't have to change schools. When the baby was a year old, they were looking for bilingual people who could work as health promotoras in the neighborhood. I signed up for the training and discovered I loved the work. I could help people like my mom who lived in the neighborhood. I could work part-time for pay and still care for my family. It's 3 years later now. Matthew is doing great. He's a 6th grader at Martin Middle School. Daniel's construction work is picking up. We have started a small savings plan so our kids can go to college. My daughter Gabriela started a pre-K program at Ortega and is very happy. I am still working part-time as a promotora, but now I am also taking classes at Austin Community College so that I can become a certified nurse assistant. I'm really proud of myself and happy.